right? So where is that taking us now? Do we need booster shots?
Well, let's see what FDA and CDC decides in the next week or so. Nothing is going to happen without government sign-off by these two critical agencies. And yes, there were announcements a few weeks ago, but that was before CDC and FDA had a chance to do their job. So we're going to wait for the official decision on that. And that's important. But the key message here is that the vaccines are not failing.
Hmm.
The third dose is important for people who are over 70, perhaps, who are immunosuppressed, people on cancer regimens, people who've had transplants, people with serious pre-existing conditions. There's good justification for a third dose, but for the general public, the vaccines are not failing.
Yeah, look,
So
I think a lot of people had questions, right, going into the original first and second dose. What would I feel? What are the side effects? And so on and so forth. Are there concerns going in with boosters? Do you know what the side effects may be getting a booster that may ease people's concerns going into it?
I think people can expect similar side effects to what they had after doses 1 and 2. And many people have minimal to no side effects. I had no side effects. Some people have a bad day. That's likely to happen again with dose 3. But when this rollout of dose 3 happens, and it probably will, it will be done in a staggered way, in the same way that doses 1 and 2 were. So older people will get it before younger people. If you got your vaccine, if you're in your 20s and you got your vaccine in May, you're not going to need a third dose for many, many months yet. So it will be done in a staggered, organized way. But it's far more important to get doses 1 and 2 into people who are not yet vaccinated for whatever reason. That's the most critical thing we can do.
What can be done to combat the resistance here? And, should be restrictions on the unvaccinated when it comes, because a lot of folks saying, you know what, I don't care what the science says. I'm not going to do it.
Yeah, this is a big problem. The disinformation, the politicization, the irrationality of it all, the idea that it will turn you into a human magnet or that Bill Gates is following you via microchips. It's all nonsense, but unfortunately, a lot of people believe it. And many of us in public health and science now think that we need to do more mandates. For example, if you needed to be vaccinated before getting on a domestic flight,
Yeah.
that would force people to make a very serious choice. If you want to travel to San Francisco from New York, you either get vaccinated and fly, or you rent a car, drive yourself, take a
Yeah.
long time. You can do it. That's your choice.
Look,
I think that thing is needed now. We have to do something because there are still best part of 100 million Americans not vaccinated, and they are keeping the pandemic alive.